Come in.
Okay. So hi, my name is Stephanie Tower. I'm going to be your student nurse for today. We're going to be assessing the neurological assessment today. Can I start off by asking you some questions?
Yes.
Okay. So, do you have any dizziness?
No.
Do you have any difficulty swallowing?
No.
Do you have any severe headaches?
No.
Have you ever had any have you ever had any head injuries?
No.
Okay. So we're going to be assessing your mental status and level of conscious. So what is your name?
Abby.
What is your name?
Abby Grace.
What is today's date?
April 27th.
Where are you at right now?
The doctor's office.
Okay, good job. Okay, so I'm now going to be observing your facial expressions, your grooming, your posture and effects. So facial expression is appropriate to situation. Your posture is erect and relaxed. Your effect is appropriate to situation, and patient is clean and well groomed, and hair is clean and neat. I'm now going to be testing your recent memory and your remote memory. What did you eat this morning?
Pancakes.
Who was the president before Barack Obama?
George Bush.
Okay, so patient is able to recall what they ate this morning and identify the president before Barack Obama. So I'm not going to be doing simple math. Okay, so I'm going to have the patient do simple math. So what is 100 minus 5?
95.
95 minus 5?
90.
Minus 5?
80. 5.
Minus 5?
80.
Minus 5?
80.
Oh.
No, 75.
Okay, so patient was able to do simple math. I'm not going to have, we're not going to be noting your attention span. I'm going to be giving you this brush, and you're going to grab it with your left hand and press it through your back and give it back to me with your right hand. Okay, so patient was able to concentrate with any difficulty. And finally, we're going to be have the patient identify a prover. So don't judge a book by its cover. What does it mean?
Don't judge a person by the outside.
Yes. So patient was able to identify a prover, and this completes the neurological assessment.
Come in.
Hi, good afternoon. My name is Jessica Morales. I am a student nurse at Prairie View A&M University, and I'm going to be assisting with the cranial nerve assessments. Now, to start off with, I'm just going to wash my hands. Now, I'm going to ask you if you can include one of your nostrils and breathe out for me. Okay, the other one. Okay, thank you. Now, I'm going to bring 2 aromas. I'm going to ask you if you can identify them. If you can include one nostril and close your eyes for me, please. Thank you. Okay. Okay. Patient was able to identify both aromas. Nasopatency is equally, and there's no obstructions. Okay. So now we're going to be testing cranial nerve number 2. We're going to be testing visual acuity and visual fields by confrontation. Now first, I'm going to ask you to cover your right eye and extend your arm and hold the book. If you could read this line for me.
So he'll ask for some old socks.
Okay, thank you. If you could close the other eye and hold your book with the other hand and read this line.
He'll make socks puppets.
Okay, thank you. If you could uncover both eyes and hold the book with your arms turned out, you could read this line.
When they're done, he'll want to put on a puppet show.
Okay, thank you. Patient was able to read specific line fields. I'm going to be mirroring you. If you could cover your right eye for me. Every time you see my fingers flickering, if you could say now.
No. No. No.
If you could stay like that.
No. No. No.
Okay, we can switch to the other opposite eye.
No. 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 No.
Okay, visual fields are intact by comfort 3, 4, and 6. Now I'm just going to be inspecting your eyes. There is no muscle weakness, there is no sagging of the eyes, and there is no droopiness. Now I'm going to ask you if you could cover your right eye for me, please. Okay, now if you could look at my nose, and you can uncover the other eye. Okay, so there's steadiness of both eyes. Now I'm going to be inspecting with my light for pupil constricted inside. If you could look at my ear, please. Okay, the other eye. Okay, so pupil constricted, both pupils are round bilaterally. Now I'm going to be looking at the same eye, however, I'm going to be making sure that the opposite eye does the same thing for constriction, okay? Okay. Okay, pupils constricted concentrically and bilaterally. So now far object, okay? Look at the far object. Now if you can look at the pin. Okay, so pupils accommodated bilateral. Number 5, I'm going to ask you if you can clench your teeth. I'm going to pull down on your jaw. Okay, so jaw strength is equally bilaterally. Masseter and temporalis strength is equally bilaterally. Now I'm going to be performing an exam for soft touch. If you could close your eyes for me, please. So every time you feel the soft touch to your face, if you could say now.
No. 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 No.
Okay, so patient was able to identify soft touch bilaterally. If you keep your eyes closed, and if you can identify this.
Sure.
Okay.
Do.
Okay, so patient was able to identify sharp and dull. So now we're going to proceed with cranial nerve number 7. And now if you could smile for me, if you could frown, if you could raise your eyebrows up and down, if you could squint your eyes. Okay, if you could pop up your cheeks, I'm going to deflate them. Okay, so facial movements are symmetrically bilaterally. Now we're going to proceed forward with cranial nerve number 8. I'm going to whisper a 2-syllable word in your ear if you could tell me what it is.
Pancake.
Okay.
Banana.
Okay, patient was able to identify both words. Now we're going to move to the rhyme test. I'm going to strike the tuning fork. I'm going to place it behind your ear. Once you stop hearing the sound, if you can say now, and I'm going to place it closer, and if you can say now once you stop hearing it, okay?
No.
Okay.
No.
Okay. We're going to do the opposite ear.
No.
Okay.
No.
Okay. So air conduction is greater than bone conduction. Now we're going to perform the Weber test. I'm going to strike it again. I'm going to place it midline and say now once you stop hearing the sound, okay?
No.
Okay. Patient was able to hear sound in both ears bilaterally. Now we're going to perform the Romberg test. If you could stand up for me, please. If you can keep your, both feet together, hands by side, we're going to hold this position for 20 seconds, okay? If you start to feel dizzy or lightheaded, you can open your eyes, okay? Okay, thank you. You can open up your eyes. It was a negative Romberg test. Okay, so now we're going to test cranial nerve number 9. I'm going to trigger the gag reflex. If you can open up your mouth for me, please. And lift your, okay, stick out your tongue for me, please. Okay, so cranial nerve number 9 is intact. Now we're going to be testing cranial nerve number 10. If you can open up your mouth and say ah for me, please. Stick your tongue down. Say ah.
Oh.
Okay, so uvular rises upon phonation, and if you could swallow for me. Okay, so cranial nerve number 10 is intact.